So good afternoon. Now we are going to carry on with the preclinical exercise on root canal disinfection. So the first step what you will be doing is you will be irrigating the canal. The canals have been prepared, should be prepared at least till ISO 25 or ISO 30. Okay. So that is basically that correlates with the your K file, the ISO 30 correlates with the tip diameter of 200 microns, which you will be using for the root canal disinfection. So here we have just made a small change in the power setting. Is not 2 watts, we are using 1 watt in a continuous wave, and sir is doing it on a lower mandibular incisor. So sir is doing it on a mandibular incisor. So average root canal length in a mandibular incisor will possibly be around 10 to 11 millimeters. So what we will be doing is first taking the tip and inserting into the root canal. So first we have already placed the saline inside the root canal. Next we are taking the tip and inserting into the root canal, and we will be going till the apex of the root canal, till the preparation wherever it's been done, and then retract by 1 millimeter. So assuming that your root canal preparation has been for 10 mm working length, you will retract by 1 millimeter, which is 9 mm. So next what you do is you have to activate the laser and move the tip back in a circular motion 1 millimeter every 2 seconds. That means for a 9 millimeter canal, it will take 18 millimeters by the time. So you have to do that calculation every time you do a root canal disinfection. And once this one has been done, then you have to irrigate again with saline. So sir has just put it in standby mode. Is a good practice to put in standby mode. Then you go into the again irrigate once, flush it with saline, or you want to flush it with hypochlorite, is up to you. You can do that, and again go back and repeat the whole procedure with a 10-second gap. Okay. So for each canal, you should do a calculation of the working length minus by 1 millimeter, and then calculate the amount of time that you will be spending inside the canal. That may be based on what is the root canal length minus 1 millimeter. So for example, in this case is a 10 mm canal, 9 mm we are going to start. So 9 into 2, because every 2 seconds 1 millimeter you will be coming out. So it is 18 seconds is the time being spent in the root canal. You cannot spend more, you cannot spend less. You have to finish that and make sure you do a circular motion. No need to touch the walls of the canal. Just run the tip within the prepared canal in a circular motion, and once it is done, I think you're doing it fast. 18 seconds, do it slow. Okay, so Dr. Ram is going to do it little slowly again. So this we will be doing 4 times for each canal. Okay, so do the disinfection, irrigate, 10-second gap, that's for thermal relaxation. Then again do the whole procedure, repeat it. Then again you will go back, irrigate, thermal relaxation 10 seconds, repeat the circular motion of disinfection inside the canal. So this step has to be done 4 times per canal. So in a multi-rooted tooth with 3 canals means you have to do totally 12 times it will be done. Okay, for each canal 4 times with a gap of 1. So root canal disinfection will take some time. It's not just showing something and coming out immediately, right? So that's the procedure for a root canal disinfection. Now one important thing to be noted here is we didn't initiate the tip for a root canal, because in root canal disinfection you need the laser beam to be transmitted. That means you want the beam to go inside into the canal. Okay, and divert some divergence. In this case it will be around 16 degrees. It will cover some aspects of the lateral aspects of the canals also, right? So that is for your root canal disinfection.